Well, good morning, everybody. Jeff Slakey, Spencer Hughes here on Daybreak, and we've got Alison Smallwood in, the Community Public Health Specialist for Mason County Public Health. Good morning.
Good morning. How are you guys?
Good. Thanks for sitting and talking with us here today. You can always find out more about public health on the county's website, co.mason.wa.us, and there are plenty of links to get access to all sorts of great public health information. You have some new information just out on obesity and where the county falls and some of the things that we can talk about. Let's talk about that.
I do. So today on Monday, March 18th, we had new Healthy Use Survey data come out. So the 2018 Healthy Use Survey. And in the Healthy Use Survey, we found that 12% of 12th graders in Mason County are overweight, and 19% of those 12th graders are obese, according to these numbers. So these numbers actually change when we look at different age groups. So if we go down to 8th graders, their numbers are 17% overweight and 21% obese. Wow. So to put that into perspective a little bit for everybody, that means that 1 in 5 students in our county is obese.
Wow.
Yeah.
What are the thresholds these days on determining obesity?
Great question. So for obesity, it's the top 5% of the body mass index, which is your BMI. You hear people talk about that. So the way that they determined on the study was they asked the children their height and then their weight, and then they calculated based on what they reported where they were on the scale of BMI.
So if we drop some 5% from 12th graders to the middle schoolers there, you were mentioning 8th graders, where do you think the drop in that lies? Is it just a change of diet as they become more adultish in their education perhaps, or more activity opportunities?
Yeah, it's really hard to speculate. One of the things that the students answered on the study was over half of them don't eat breakfast.
Wow.
And that becomes higher when they are in the 12th grade age. You know, they're probably just rolling out of bed and barely making it to school. I know I did when I was that age. So yeah, I'm wondering if their caloric intake is just a little bit lower and maybe they're more active in the 12th grade age range. Yeah.
How did this study come about? Is it a specific to just school age children? Or
so the Healthy Use Survey is a study that's done every 2 years, and it's actually a Washington State study. So they survey every school district that's willing to participate, and they grab a handful of kids, and it's self-reported, right? So it's totally anonymous. The kids go in, they answer a range of questions. It's actually over 200 questions. Wow. So there's way more on there than just physical activity and nutrition, but those are the focus today that we're talking about. So yeah.
And you feel like since it's a self-reporting and anonymous, that you're getting some pretty decent numbers? Yeah,
so with self-reported data, a lot of the times we feel that it's actually underreported. So a lot of kids will say that I would say that my weight is lower than what it actually is, or say that you're taller than you actually are. So these actually are probably pretty conservative numbers that we're getting.
I do that on my driver's license.
I know, right? Everybody does a little bit, just lie a little bit.
6'2", 130 pounds.
So that wouldn't, put you in the top 5% of that BMI range, but it might skew it just a tiny bit. So.
And if you have, I know these just came out, but where does Mason County sit in relation to the rest of the counties?
Great question. So as far as compared to the state, I don't have the other county numbers at this time, but compared to the state, we are higher. Okay. Our numbers are higher. They're about 10% depending on which grade you're looking at. So
what are some of the problems that come from being overweight, obese?
That's a really great question. So one of the biggest things is you can have high blood pressure, and that can lead to hypertension and heart disease. So those two things are really major that we worry about in your health as you age. Then we also have, I'm sorry, let me find here on my notes. Diabetes, type 2 diabetes, and cancer rates can also increase with increased obesity.
Are there the problems with 1 in 5 ish school-age kids facing obesity based on the markers from the BMI and things like that. So are we seeing these hypertension rates, these diabetes rates show up earlier in life now?
They are, yeah, they are showing up earlier. I don't have any data today to support that, but I know based on things that I've seen before that yes, those are showing up earlier in life. And there is there's some studies out there that say the earlier that you become obese, kind of that becomes a factor for the rest of your life, right? So you're always going to be kind of obese if you start those habits early.
And I know that kids' bodies and the physiology, it's changing, sometimes into their 20s by the time everything shakes out. So maybe not the time to make huge dietary changes. But what are some things that kids or parents of kids who may see their children a little more on the obesity scales to get them more physically active?
Yeah.
Is it still 20 minutes a day or 30 minutes a day?
So it's really interesting that you say that because the new recommendation is now 60 minutes a day.
Moly.
Yeah, 60 minutes or more a day for kids 6 to 17 age range that they're recommending now. So I actually have some numbers. It looks like only 1 in 4 students on this survey met that criteria.
Sure. That's a long time.
It is.
Where are they going to fit in the video games in the time?
Exactly, right?
All this other stuff to do.
So yeah, if you're playing a sport, you're likely practicing. Those kids are likely hitting that number. But if you're not involved in any kind of sports activity or you don't, walk to school, then there are definitely some deficits.
Wow,
there.
60 minutes a day is a long time. And is that above how would you define, is it strenuous activity?
Yeah, so it's just getting that heart rate up. Anything that increases the heart rate and makes you breathe just a little bit heavy. So it doesn't have to be, running necessarily, but if you're taking the stairs or whatever, all of that adds up. So they're talking about over the whole day, 60 minutes of increased heart rate.
Even if and I do this at the grocery store or at different places, I'll park not as far away as possible, but not as close to the doors. And, it's a minute or two here.
Yeah,
but
that's a great strategy. Any little thing you can do will help. And one of the things that I found that was easy for me is to cut sugary drinks out of my diet. So I would encourage everybody to kind of rethink their drink. So there's a lot of hidden sugars, a lot of hidden sodium, and just calories in general in things like Gatorade, like regular Gatorade that you wouldn't even think of. Things like Sobe, Snapple teas, stuff like that.
Stuff you would assume is healthy.
Right.
Or
it's an energy drink, right? So, or, Gatorade, it's refueling you after you work out. Well, yeah, that's great if you're working out, but if you're not, that's full of calories and sugar and stuff.
That's
so
a good point.
Replacing that even with water is a great way to cut calories, but also just, refuel your body with water, which
Tons
your body
of benefits
needs.
from water.
Yeah, absolutely.
And they have those Propel waters. I mean, there's some, you don't have to add a lot of stuff.
What about that stuff? Can you add those little flavor?
Just to help
and anything that's like diet or like 0 calorie is probably okay. It's where you have to watch is the sugar and the sodium content and the calorie content.
Like Kool-Aid? Probably not so good.
Kool-Aid.
Probably no.
Yeah.
Interesting. Alison Smallwood from Public Health here today talking about some of the latest numbers on the obesity epidemic. It's still countrywide. I mean,
it's still countrywide. We're very consistent with the rest of the country, but as far as Washington State, we could do better.
Sure. Well, it's nice talking with you today.
Yeah.
And great opportunities for you to change your diet, change your lifestyle, perhaps. 60 minutes a day for kids and adults, I'm sure, could benefit from 60 minutes of outdoor activity.
Yeah, and I just want to emphasize, small changes really can make a big difference. So if you feel like you can only do this one thing today, do it.
Yeah.
Don't feel like, I can't. It's so daunting. I can't do it. Small changes do make a big difference.
Oh, very nice.
Absolutely.
Nice to talk with you.
Yeah, nice
Thanks
to
for
talk to you
coming in.
guys
We'll get
too.
you back in here before too long talking about some more great things. Mason County Public Health, again, online, co.mason.wa.us, and talking with Alison Smallwood, Community Public Health Specialist. Thank you.
Thanks.
Thanks.